It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello, I'm Dr. Annie Varughese, and welcome back to Best Docs Network, where we feature some of the finest doctors in Houston. Today, we talk to Dr. Stephen Rose.
One of the things that I learned early from Dr. Tabar, who was the person in Sweden who did that two-county trial, and that was my first introduction to real quality mammography and how it should be done. But I learned that we needed to work together and you needed to understand the pathology. So immediately the first benefit was to work closely with the pathologist.
Dr. Rose and Dr. Sutton enticed me to go to a meeting out in California where Dr. Laszlo Tabar was speaking on mammography and sophisticated ways to diagnose early breast cancer. And to say that I got hooked by Dr. Tabar would be an understatement. And so we came back in late 1995 and determined we wanted to form a comprehensive breast center.
At the time that we started this format, we were really the only area in Houston outside maybe the medical center itself in which this was a routine sort of event of meeting on a weekly basis with all the different physicians involved with the breast cancer diagnosis and treatment planning.
It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are.
I think the most powerful thing that we have been doing for close to 20 years is the weekly conference, and it's dedicated to women who are recently diagnosed.
And so it takes an element of commitment on all the different parties involved, but at the same time, when you see the benefit of that as far as our ability to do a much better job taking care of the patient, it's worth every second.
So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant. They could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing that's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger, and for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him, and I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So He has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, you know, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a Center of Excellence in Nose and Sinus Disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
Caffeine is a drug, but it's a legal drug, and it has great side effects, and we love what it does to us. There are certain downsides to it. Now remember, caffeine is even found in small amounts in decaffeinated coffee and decaffeinated beverages, but not in high amounts. Now when you drink caffeine, good things happen, like alertness goes up, you feel better, you think quicker. There's even been studies that show you're more sociable and more friendly and more likable. Isn't that a cool thing to have from a legal over-the-counter drug? There are certain downsides to caffeine. For example, it can raise your blood pressure a little bit and your pulse rate. That's usually not a big problem. There are instances where it can raise the risk of bladder cancer, but that's in people who drink high doses, like 6 or 8 doses of caffeine a day. Now also, if you're over 40 or 50 years of age and you drink caffeine in the afternoon or evening or prior to exercise, you probably should wait 3 hours before you exercise, because caffeine can raise your heart rate, and when you get all that adrenaline from exercise, you can get extra beats, and that can cause the rhythm of your heart to be a problem. Don't be too afraid of it. Just don't exercise heavily if you're older and you drink caffeine within 3 hours.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
For more information about any of the doctors you've seen on our show today, go to bestdocsnetwork.com. Now it's time to meet my patient, Yolanda.
I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk, and Dr. Varughese talked to me during the recovery time, and I asked her, in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish. This is such a fabulous event. It's called Go Red for Women, and it's putting together women from the community, physicians, hospitals, everybody supporting women and heart disease and the awareness for women to protect and support. Even children can benefit from this event. So I think it's so fabulous, and that's why I wanted Best Docs Network to really talk about it.
My speech today is going to be about how I'm dealing with heart disease and how to have an optimistic and positive attitude while going through something or anything difficult in your life. I keep laughing, I keep smiling, try to stay positive about things. I could be stuck in the hospital, but instead I'm home with my family.
The biggest way to prevent these problems is education. So the main reason for this type of event is to educate, and through that we raise funds and can get the word out.
Number one, it educates people on what has happened over the last several years, and it brings to the forefront, with women in particular, with Go Red for Women, to listen to your body and know your symptoms.
The most important thing about cardiovascular disease is the #1 killer of women in this country. And 50% of women or men with cardiovascular disease die suddenly, without any symptoms, without any warning.
I just believe getting the word out to women especially. We always are tired and run down and raising kids and going here and there, and we might just think, oh, we're just tired, my neck hurts for some reason, and it's no big deal, but it could be a sign of a heart attack or a stroke.
And women, we're just, and they're, as we know as men, are different. And they present differently. Fortunately, stroke-type symptoms are about the same, but again, another large focus for us is heart disease, and they are completely different in the way they present as a general rule than men.
Cardiovascular disease and the awareness for women is such a tremendous topic, and that's why Go Red for Women is such a marvelous cause, and I just want everybody to support it.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
I weighed 236 pounds. It was just time. I needed to do something to feel better, healthier. I needed to feel healthier. I needed more energy. I needed to do something. I had the lap band as opposed to the sleeve or gastric bypass because it was less invasive, and it was really the right decision for me personally.
She's increased her exercise in response to having the control to lose the weight more easily, so there's a positive reinforcement there. If they do the right thing in terms of exercise, if they're consistent, then they see a bigger drop-off than they had seen before they had the surgery.
As time went on, I started dropping the weight, eating, slowly, liquids, and then your soft foods, the way that you were told to do it. And things just started to work out for me. I started exercising more, and eventually it just started falling off.
Right now she's running, she's trained for a half marathon. And those are great things in terms of the exercise side of taking care of the weight. When it comes to eating, it sounds like she's doing a fairly good job switching to things that are lower calorie, less animal fat, and lower glycemic index. But it sounds like something, occasionally she eats things that aren't ideal for her. But I think her exercise takes care of that, and that's why she's at ideal body weight right now.
Physically, to be able to not huff and puff going up and down a flight of stairs, you know, mentally, to work, to, you know, educate yourself, I think it makes it easier to feel confident about yourself. It just makes things that much easier. Before the surgery, I was 236 pounds, and 3 years later, I am down 85 pounds.
Unfortunately, with a lap band, it's difficult to tell sometimes ahead of time who's going to do well and who's not going to do well. And we have patients that do very well with it, and that's great. The problem is the predictability when it comes to the lap band. So she's an example of someone who's used it as a tool the way it's supposed to be used. Unfortunately, that isn't the case with everybody.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. patient would be in the hospital for a week and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. I went home in the car, and really I was up and walking around within, just that day I was up walking around, you know, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine. I
think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point. You know exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely. Her pain has gone away completely, and her varicose veins have gone away completely as well.
Thank you for joining us for this edition of Best Docs Network. For information about any of our doctors on any of our shows, go to www.bestdocsnetwork.com or email us at info@bestdocsnetwork.com. For Best Docs Network, this is Dr. Andy Varughese. See you next time.